Okay, so in this video we'll take a look at the cubital fossa, which is a triangular shape depression on the front of the elbow joint between the arm and the forearm region. So it is actually a depression present between several muscles. So different muscles are forming its various boundaries. Let's take a look at each of these. So medially there is a muscle of the front of forearm, that is a pronator teres. इसी का lateral border, basically medial boundary बना रहा होता है हमारे cubital fossa की, and then the laterally we have the medial border of the brachioradialis, a muscle of posterior compartment of forearm, making its lateral boundary. And then if we talk about its base, so the base of this triangle is formed by an imaginary line connecting the two epicondyles of humerus, and then there is an apex formed by the overlapping of the pronator teres and the brachioradialis muscle. Then we say that what is forming the roof or the superficial aspect of this cubital fossa, so that is the skin, the superficial fascia. Now there are certain structures present in the superficial fascia which will be forming again the roof of this fossa. Now these structures are the medially there is a basilic vein, laterally there is a cephalic vein, and accompanying the basilic vein medially there is a medial cutaneous nerve of forearm, and accompanying the cephalic vein laterally there is a lateral cutaneous nerve of forearm, which was a continuation of what, the musculocutaneous nerve, right? And there is a medial median cubital vein connecting the cephalic and the basilic veins as well. So then again on the roof of the cubital fossa there is just below the superficial fascia there is a deep fascia, and still below it there will be the bicipital aponeurosis covering this fossa, covering this depression, right? So ये तो होगी उसकी roof की बात. And then what is forming the floor of this fossa, what is present deeper to it, so that is the muscle, that is the brachialis muscle coming from the arm region, and there is a supinator muscle which is a muscle of the posterior compartment of forearm. So brachialis and supinator are forming the floor of this fossa, of this depression. And then there are certain contents or certain structures which are present in the fossa in this depression. So these are from medially to laterally, these are the median nerve, this is a brachial artery जो कि बाद में divide करते हैं into its radial and annular branch. Then there is a bicipital aponeurosis as well as the tendon of biceps present still medial, still laterally. And then the lateral most content is the superficial branch of the radial nerve, right? So from medial to lateral these are the structures present in the fossa making the content. So these are the four contents of the cubital fossa present in front of the elbow joint. So with this note we're done with the cubital fossa as well. So thank you so much. Allah Hafiz, take care.